Hi, this is Dr. Joanne Halpert, Doctor of Chiropractic. Are your kids getting on your nerves? I know a lot about this. I've actually helped raise 6 kids, and I know what it's like when they give you the attitude, and it can be very difficult to deal with. But what I want to share with you is that when a kid is acting out like that, that is a cry for help. And it can be very hard not to take it personally, but that's why we're the adults. And it's really, really important, especially if you see a change in behavior, if this has not been happening all along and all of a sudden you get this, obstinate or defiant attitude, this is really a cry for help. Something has happened to your child and it is deeply upsetting and they don't have the skills, the strategies to deal with it. So what do? All right, they're acting out, they're angry, they're upset, and they're going to take it out on the person who is safest, which is you. So we need to be able to deal with that. But first, we have to recognize, wow, there is a problem here. Second, we have to be able to not take it personally. Because if we take it personally, we are not available to help our child. And that is our job. Now, when a child has something happen, and we may have no clue what has happened, but it could be bullying at school, it could be the fact that they have no friends at school, or it could be the fact that they have lost a friend. Something happened at school and they're just really, really hurting about it and they don't know how to deal. So they become more defended, they become more tighter, and then what happens is things that normally were not a problem that they could handle, they can't handle anymore. So the slightest thing sets them off. Now, there are a lot of things we can do to support this child. One is to have their nervous system evaluated, because I can tell within minutes if a child is stuck in a fight or flight mode, which is keeping them in this irritable, agitated state. And when you're in that state, you don't make good decisions, and you don't have the ability to handle things as well. The other thing we can do is we can talk to the child. What's been going on? Now the thing about that is, depending upon their age, they may not be able to or willing to talk. That's what's so wonderful about evaluating a spine or a nervous system, because you get so much information without any words. The third thing that you can do is watch for other signs that things are distressing. Maybe they're not eating the same, maybe they're not sleeping well. These are all signs that this isn't just a phase, that they'll pass through, and we want to be attentive to that.